All right, everybody, we are here at the health event in Las Vegas, and it has been electrifying and amazing. Just guests that are professionals in what they do, improving lives, improving business models. And today I have the privilege of having two very special guests. I've got Robbie Hughes and Mark Clermont from Lumeon. I want to go ahead and open up the mic to you guys to introduce yourselves and tell us a little bit more about Lumeon and what problem you guys are solving for.
So my name is Robbie Hughes. I'm the CEO and founder.
And I'm Mark Clermont, CFO.
And the problem we're after is unwarranted variation. So the issue we see in the market today is we see a ton of nurses in call centers. We see a huge amount of waste and repetitive use of the same care resources. And frankly, we see a terrible patient experience everywhere in the health system. And our thesis is all of that is coming from fragmentation that results from inconsistency in the way people practice medicine and the way that's then delivered across the care continuum.
It's a big need, and you know the variation is large. Tell us how you are operationalizing this technology. What is it that you're doing, and how does it work?
Well, we look at first you have to start with the fundamental premise of clinical systems. And so if you look at an EMR platform, architecturally, it lets the physician, first is their center of gravity, and encourages the physician to make clinical decisions and supports it. And frankly, there are a lot of great tools out there to help physicians make great decisions. Intertwined with that is they also let the physicians be responsible for the execution of clinical care. And when you unpack what's going on there and you look at the execution pieces, and you wonder, how are people still falling through the cracks? And it's because the execution layer is still dependent upon people. Mm-hmm. And fundamentally what we've done is recognize this need. And frankly, when you look at the types of actions that can be taken out of these platforms, when the types of actions that support clinical execution, many of them can be automated. They certainly can be supported by systems that like what Lumeon provides.
So I think the key thing is, if you take it, as Mark says, from an execution point of view, what's really needed is an enterprise-wide system that automates a lot of the activities that are common, routine, etc. So for us, what we're doing is we're combining a bunch of stuff. So a clinical decision engine, an automation engine, and then a kind of an outreach engine that connects with the various constituents of the care continuum. And what's neat is out of the box, it'll do 80% of what you need. But that last 20%, that's specific to the provider, and we can help with the providers to localize that to their specific needs. So it lands quickly, it delivers value very, very quickly. And providers love it because it takes away work that they don't like doing. Patients love it because it transforms the way that they experience their care. And fundamentally makes the whole system a lot more efficient.
Love it. No, it sounds like a fantastic tool for providers to really up their game and patient experience. At the conference, there's been so many different technologies and people doing amazing things, just like you guys. Is there anything in particular that has stuck out as something that you'll walk away with doing things differently?
Well, I think one of the themes as we've been having conversations, and certainly as you walk around the exhibit hall, clearly we have a ton of data. Mm-hmm. And we're getting better and better at surfacing important insights in delivering care. Certainly, again, in support of clinical decisioning. At the same time, we hear this, and we heard this over and over again in our conversations over the past couple of days. I don't know how to make that actionable. I can't hire any more care nurses than I have already, and already we're experiencing failures. And I'd say if that were the overarching theme that I've heard loud and clear from health systems, ACOs, doesn't matter the type of healthcare organization, universally you have this challenge.
Yeah. I would summarize that really as EMRs have done a great job at helping us collect a ton of data. There's then been a huge push over the last couple of years to turn that into insight, but that last mile, turning that into action, that's where the big opportunity is for us.
Yeah, wow. And so is there anything from the conference that you learned or anybody that you met that you feel things are going to be better because of it?
So,
And if the answer is no, it's no, but maybe there was something and I'd hope to learn about it.
there's one thing in particular that stood out to me, which is, we've been very, very engaged on the provider space. We know where their pain points are. We know that's kind of where our bread and butter is.
Mm-hmm.
But logically, if you think about the fact that you're delivering more consistency, more repeatability, better quality to the care delivery system overall, you'd think that would be something that would be interesting to payers. But obviously in the US, the reimbursement system hasn't really been that aligned with how do you reduce the cost of care. It's been more about how do you deliver the activities that are going to maximize your reimbursement. Correct. So for me, having the number of payers that we've had at this show approach us and say, look, we're interested in getting rid of prior auth. We're interested in how do we ensure that our partner providers are delivering the best possible care and we can reimburse them favorably for doing that. I think that's a huge opportunity for the market overall, in particular for us, and one that I just didn't expect.
That's great.
People tend to have this perception that payers move very, very slowly, nothing ever changes, but that's not been our experience here at all.
Wow. Well, you know what? I appreciate you sharing that, and I feel that way too, and it's good to capture the fact that there are so many different stakeholders here at the conference. Usually, we're also siloed, and we're not talking to each other, and that's one of my main things that I always talk about on the podcast. It's like, hey, nobody talks to anybody. So I love that you pulled that out of this, and that health is doing a great job of creating that silo connection so we could all work together in a better way. The thought about payers being more innovative. Have you had any luck with maybe vertically integrated payers, such as Kaiser, who is also the health plan? Maybe they might have better, more vested interest there. I don't know. Do you want to comment in that area at all?
So, IDNs, integrated delivery networks, any provider that takes any kind of risk, they're essentially the perfect customer for us. So the interesting thing is if you look at how a lot of these organizations are designed, it isn't necessarily in the way that you would think. Kaiser's got a separate reimbursement arm from the provider arm, and their interests are not always going to be aligned. So I think it's important to recognize that the market in the US, it's big, but it's not in any way uniform. There's a huge amount of innovation in pockets. But for us, whether it's servicing a fee-for-service market in the pursuit of quality, whether it's servicing an at-risk market in the pursuit of efficiency, it's all the same problem. It's how do you deliver that consistency? How do you do whatever you're doing to the very best of your ability again and again for every single patient? And interestingly, that is a problem that is common across the entire space, whether it's at risk or not.
And you think, looking at, this was a remarkable conference for identifying innovation. It was just filled with really outstanding products, and I think even more so than we've seen in the past, these are products that have moved beyond, moved much more closer to reality in terms of something that can be implemented.
Yeah.
And so we're really on the cusp, I think, of seeing this explosion of effectiveness in health. At the same time, how are you going to tie all these things together? And AI is interesting and could be the most effective thing, but go back to the very beginning of this conversation, we've enabled physicians to make tremendously better decisions and more informed decisions. It's not unlike the AIs. Maybe they're coming up with great decisions too. At the end of the day, they still need to execute. And if we haven't focused on that execution layer, then we're just not going to maximize the value of those innovations. But overall, I have to say, this is remarkably exciting to see all of these near-term innovations coming together.
Yeah, that's a great way to put it, guys. And, you guys are part of it. The work that Lumeon is doing is certainly ahead of a lot of what the status quo is. So I also want to recognize the work and efforts that your team is doing to further healthcare outcomes and the practice of medicine to make it better. So this is really kind of an opportunity for you guys to just say to the listeners what you would wish they could do to connect with you guys and what the opportunity is there.
So I think if you think about how you want to start this stuff, how you want to get it going, a big mistake that we see that I think it's really important to get over very quickly is be very clear about what your objective is. What is it you're actually trying to accomplish, and make that something measurable. There are so many digital health and, in fact, healthcare projects more broadly that go after something like quality. We just want to deliver better quality. That's not a measurable goal. That's not something that you can really get a team behind that is going to be successful. So if you want to, if your pursuit is efficiency, define what that means
what
to
does that
you.
mean?
Make it measurable, and focus your project around the smallest possible way of delivering to that goal. Once you've done that, then you'll have a project, you'll have something that'll be successful, and we can support that and we can help you scale it. But be very clear about what your objective is, because nebulous goals don't really help anyone. And I think there's a lot of money that has been thrown historically in the digital health space towards just doing stuff because you think it's interesting, or just because you think it's sexy, and that's not really going to make a big impact for the organization.
Yeah, it's a great point. Mark, any thoughts there?
Well, again, I come back to this innovation construct. Certainly making things simple in terms of implementation is critical to success. I like the idea that as we're seeing these implementations coming together and we see more telemetry data, how patients are moving through their care pathways, this is data that they've never seen before. And for organizations to then have that data exposed to them, they can then look at the efficacy, maybe even from one location to the next. If we're doing comparable surgery types in two different locations, remarkably, we still follow very different practices from one place to another. Why is that? And now we can start to look at the efficacy and beneficial outcomes from those. That will help influence decisioning. We've found that providers have been very open to change as long as they understand the data and can see some of that data.
Brilliant. Well, folks, hope you've enjoyed this clip. Robbie Hughes and Mark Clermont from Lumeon here in Las Vegas, the health event. And just want to thank everybody for tuning in today, and I want to thank both of you for being here with me.
Yeah, thank you.
Thank you.